To start, I would like to begin by acknowledging that we are meeting on the lands of the Bidjigal people of the Eora Nation. And I'd like to pay my respect to the elders past and present and extend that respect to other Aboriginal and Torres Strait Islander people joining us here today in the audience and online. My name is Tyson Narapalli. I am the coordinator of the New South Wales HIV Prevention Research, Implementation Science and Monitoring Partnership, also known as PRISM. So thank you for joining us for this joint session of the Kirby Institute Seminar Series and PRISM's Implementation Science Research, Practice and Evaluation Seminar Series. A quick background about PRISM and our seminar series. So PRISM is an NHMRC funded partnership which aims to generate findings to inform the development and implementation of HIV prevention initiatives to achieve the targets of the New South Wales HIV strategy across its 4 pillars: stigma, testing, treatment, and prevention. Our partners include the New South Wales Ministry of Health, the Centre for Social Research and Health here at UNSW Sydney, ACON, Positive Life New South Wales, Asham Health, the Multicultural HIV and Hepatitis Service, POSHET, and staff from other academic, public health, and community-led organisations working in the HIV sector. This is the 7th seminar in the seminar series. And this seminar series was established to help us and our partners gain a better understanding of implementation science, which has really emerged as a discipline to support the translation of research findings into practical applications. This seminar series serves as a forum for learning about and discussing implementation science theories, frameworks, and tools specifically tailored to HIV prevention and other infectious diseases. Just some quick housekeeping. So the format for today's seminar there will be a presentation followed by a Q&A. Those online can ask questions throughout by clicking on the Q&A icon at the bottom of the screen. It is now my pleasure to introduce Thomas Rudge, who will be presenting today's seminar. So Tom is a PhD candidate in the Viral Hepatitis Clinical Research Program here at the Kirby Institute. And his background is in development studies, which informs an equity-focused approach that considers social and cultural factors shaping health and healthcare access. Using implementation science, his research enhances the adoption, scale-up, and sustainability of hepatitis C testing and treatment. So please join me in welcoming Tom. Thank you.
Thanks, Tyson. Thanks, everyone, for coming. So what I'd like to do today is take you through a project that we've been working on for a couple of years, using implementation science, but also to explain some broader implementation science stuff around it, just to sort of add a little bit of extra information and context. And then I'll finish up with some reflections of mine of using implementation science for the past couple of years as a sort of relative newcomer to using it. First, I'd like to acknowledge that we're meeting on the lands of the Bidjigal people of the Eora Nation, and I extend my respect to elders past, present, and emerging, and extend that respect to any Aboriginal or Torres Strait Islander people who are joining us here today. So what is implementation science? If you're still wondering that, which I think I do sometimes as well, it's because there's not really one single definition. Different authors emphasize different aspects. It's the scientific study of methods and strategies, the application and integration of research evidence into practice and policy, the scientific inquiry into questions concerning implementation, the study of methods to promote the adoption and integration of evidence-based practices, and applied research that aims to develop the critical evidence base that informs the effective, sustained, and embedded adoption of interventions. So that's a lot of mouthfuls there. Now, please make sure you study these and memorize them, because there's a quiz at the end with prizes. I'm just kidding. It doesn't really matter that much because there's just one common thread. It's closing the no-do gap. think of implementation science as methods and strategies to help the adoption and integration of evidence-based practice. For me, it's been a systematic way of understanding and improving how programs work in real-world settings. What program are we talking about? The national program. The Australian Hepatitis C point-of-care testing program is one of the first national scale point-of-care HCV testing programs globally. It aims to increase access and scale up HCV testing, and it supports decentralization of care and evaluation of point-of-care methods for infectious disease. There's a huge, it's hugely collaborative. Clearly, there's a huge amount of partners and sites across the country, and over 60,000 tests have been done to the end of last year. So you look on that map there are a lot of sites, which means a lot of implementation settings to consider. So this is where we came in. Success so far on the national program. It's achieved wide uptake, and we know point-of-care testing works. The foundations are there. We needed to learn what's enabling success, where are sites or stakeholders struggling, how can we strengthen what works and improve what doesn't. So with this in mind, we put together this project. It's a multi-methods implementation study, documents, meetings, and stakeholder interviews as our data sources, with the goal of identifying and rating the factors or determinants that influence implementation of the national program. And we want to generate rapid, actionable insights that guide policy, support scale up, and strengthen fidelity. So the data sources: 28 documents, 125 meetings, and 30 interviews in a proposed sample across the country. We stratified the stakeholders. It started off as just one group, and then some early feedback from co-authors was that it would be interesting to group them depending on their sort of connection with the program, so we could compare and contrast these perspectives. So we ended up with 3 groups: policy and funders, sites and community, and program partners. And it's a pretty good spread across the country. The 7 is national. So it's a pretty decent representation. We read a lot of meeting minutes and transcripts covering cultural governance, clinical oversight, implementation and delivery, and quality and evaluation. And then the documents were things like protocols, ethics, terms of reference, manuals, logistics, strategies. So how do we make sense of all of this? This is the first framework that we used. It might be familiar. Can I get a show of hands, actually? Who knows the CFOP? Yeah, do you love it? It's great, isn't it? The Consolidated Framework for Implementation Research. So this is how we coded our barriers and enablers to implementation. You can see there are 5 domains representing the broad settings of program implementation and about 48 constructs throughout. You can see on the right, the thing, the innovation. In this case, it's point-of-care testing. Whatever you're implementing in your program, whatever you're trying to understand the implementation of, that's the innovation. The outer setting at the top, or actually I should start with the inner setting, is within organizations. The outer setting is the space between organizations, so the state and the country. And then you have individuals down the bottom, which is pretty self-explanatory. And then implementation process on the right. So we use this framework to code everything we found in the programs documents, the documentation, the meetings, and the interviews to make sense of it. Once we had coded everything, this is how we analyzed it using this classification system, which is from this paper that you can see at the bottom. We reviewed the coded data. We created themes, which became implementation factors. And then we rated each factor between -2 to +2. And then we discussed each factor to reach consensus. Yeah, you can see the classification at the bottom there. -2 is a major barrier, through neutral and mixed factors to +1 and +2, a major facilitator or enabler. So each factor got a rating. 2 of us, myself and the second author, Will Nichols, did this, and then spent weeks or months arguing about, whether something was +1 or +2, or you've never heard someone argue about whether something's 1 or 2 as much as we did. But we landed on consensus for 580-ish implementation factors. To begin with, this was okay. We were happy little researchers when we'd found 12 implementation factors in the documentation. But then we went through the meeting minutes and transcripts and found 127 implementation factors, and things started to get a little bit tricky to keep track of. And then we went through the interviews, and that led to this. We found another 450 odd implementation factors. This is a photo of me from last year. I'm feeling better now. Thank you. So, is there a better way? I hear you asking. Well, maybe. And it's AI, of course. It's always AI now. So we wanted to leverage AI, or specifically large language models, to see if we could deal with this huge amount of data. So we built an AI-assisted sentiment analysis system. In simple terms, sentiment analysis looks for emotional tone in text, whether something sounds positive, negative, or neutral. It's used everywhere from social media monitoring to healthcare and disaster response. And here we're using it to understand how people talk about what's helping or hindering implementation. We built this analysis pipeline. You can see down the bottom. It's pretty straightforward, really. Input the data, quotes mainly from interviews, but also just text from documentation and meetings. A large language model that's locally run. This isn't running something online through ChatGPT or something like that. It's just a run on a local computer. Assesses sentiment polarity and intensity. We built a kind of second phase in there, a custom sentiment lexicon, which is how you would traditionally do a sentiment analysis. You'd have a lexicon of words and phrases that were positive or negative, as a little bit of a backup system, and as a way we can't, at short sort of notice, we're using a ready-made large language model from the internet. We can't teach it something new. So when we find language, particularly implementation sort of specific language, that the model doesn't recognize that well, we can add it to our lexicon so that it knows whether it's positive or negative. So it's this two-layered system that outputs a rating on the same scale as we were rating. So is sentiment the same as ratings? No, not exactly. And this might look terrifying, but it's brief and it makes sense, I promise. These bubbles are implementation factors colored per CIFAR domain. Factors closer to the dotted line through the center are when sentiment and the researcher's ratings more closely aligned. So overall, you can see they move in the same direction, positive with positive, negative with negative, but it's not a perfect overlap, and it's not meant to be. The AI is picking up emotional tones across hundreds of quotes in minutes, and where it differs, that actually often highlights contextual tension, places where our human consensus smooths over complexity. So, for example, I'm not sure how readable that is, but it says financial incentives for clients are effective in encouraging testing. We rated this a +1, a moderate enabler to implementation, because what we were seeing in the data was that financial incentives were useful, they were necessary to get people testing. The AI sentiment analysis rated this a negative, a -0.21. When I saw this, I thought it was a discrepancy, that the system wasn't working properly. So I went back and I checked the data. And what I saw was people saying that incentives were useful and necessary, but they weren't always available. They really needed them, but they couldn't always get the amount they wanted. There were budget constraints and so on. So it's an enabler with some negative sentiment attached because it's not an easy one. Another example on the other end, which is a long one, ongoing debates about the accuracy of point-of-care testing compared to lab methods highlight the need for robust evidence to build confidence. We rated this a -1, a moderate barrier to implementation, the AI plus 0.29. Again, I went back and looked, and people were saying that this was an issue to overcome, but basically it was being overcome, was what they felt. So with this system, the initial idea was to see if it could mimic the ratings. Is sentiment the same as this rating system? And it turns out it's not, but it's something separate and useful. In this way, we can have an enabler that's not available. We can also have a barrier that's on its way to being solved. So how aligned are the ratings actually? About this much. And if you're like me and you need a reminder of what these actually mean, the Cohen's kappa is how reliably the model agreed with human ratings after accounting for chance. The Pearson's R, how closely the model scores track the direction and strength of human ratings. And the accuracy is how often the model agreed with the human coder on the rating label, whether it was positive, negative, or neutral. It was interesting to see here, I haven't looked into this and checked, but the lower, slightly lower kind of alignment on the innovation and process domains, to me, having sort of gone through the data so much, is potentially because of that domain-specific language in the innovation and the process domains that I mentioned earlier. Outer setting, inner setting individuals, these are all people talking about the workplace environment, communication strategies, motivation, skills, training, policies, and so on. It's stuff that this language model could understand better. The innovation, more technical language on point of care testing and process on implementation. So that's my guess at this point. So if you wanted to boost these numbers, you'd go through and you'd add stuff to the lexicon. But as I said, we're not going for a perfect alignment. Where it's not aligned, there's nuance to be found. So why do this at all? The manual process of identifying and rating all these factors, it takes a really long time. You read, rate, and discuss, reach consensus, repeat. It can take weeks or months. Using the sentiment analysis system, it can take 20 minutes to do the same data set. And as I said, it's not giving us the same thing, so it can't replace it, nor would you just want to completely replace the human analysis. But it's giving something that's useful. I imagine it as a kind of a potential system for a first pass over a large data set, to identify where those issues are, those pain points, if you like, somewhere where you need to focus first, and the human analysis is what you ultimately rely on. Okay, so some results. I'll keep it mostly high level. This is a heat map of the CIFAR. The domains are in bold, innovation, outer, inner, and so on. And the constructs are within it. It's stratified to the 3 stakeholder groups. If you look down the bottom, you can see policy funders, program partners, site partners, and community. Those are the 3 groups, 1 for each column there. Orange are barriers, blue are enablers, and stronger colors are stronger factors. So this heat map gives us sort of a bird's eye view of everything, and where there was agreement, where there were barriers, where there were enablers, and where there was agreement and disagreement between the stakeholder groups. So just running through it fairly quickly, we can see partnerships and connections as a construct was a consistent enabler for everyone. There were 56 factors coded here. The relative advantage of point of care testing was, fairly uncontested. It was universally recognized. We had 60 factors here. Everyone agreed that point of care testing had a relative advantage over alternative methods. High-level leaders was emphasized, 16 factors here. Opinion leaders or champions, we usually refer to them as, or we coded data about champions to opinion leaders, a major enabler to implementation. Problems here, IT infrastructure, physical infrastructure, and work infrastructure were huge barriers. Everybody agreed. Likewise with financing, local attitudes, which refers to stigma, and local conditions, which is a pretty broad construct. It can encompass economic, political, technological issues. And a little bit of disagreement. I was kind of a bit surprised at how much agreement there was across the groups. You can see a lot of the time it's all orange or it's all blue. There was a little bit of disagreement here that I thought was interesting between the program partners and site partners and community on innovation deliverers, which is people delivering, delivering point of care testing, as well as clients. And I think you could see program partners are talking about innovation deliverers as enablers most of the time, while the site partners, who are sort of comprised of the deliverers in large part, are talking about it as a barrier. So I thought it was interesting to see how program partners were praising staff as a whole, but then when you zoom into the site, you can see that people are having perhaps sort of issues at the individual level, interpersonal. So a aggregated ranked list of implementation factors, so taken the groups away, and I'm just going to go through two of these. So we can see, and these are in order by that weighted ranking on the right: IT and connectivity, staffing, supply chain, stigma, and then enablers, advantages of point of care, benefits of recipient-centeredness, and so on. So how did we rank them? We didn't want to rely on quote count. More quotes meant more important. So we developed a pretty simple, pragmatic system for differentiating the spread and prevalence of each factor. So each implementation factor had, it was a grouped set of data, such as quotes, with sources attached to it, and then data for the sources, which sector they worked in, which state they worked in, or where a meeting was taking place. And so each factor got sort of points, I guess, for each sector that we identified it in, each state, and then triangulation when it was between multiple data sources. So if we saw something in interviews, and we also found the same factor in meetings, it got these sort of triangulation points. So this all added up to evidence strength. So it's not definitive, it's a pragmatic way to prioritize factors based on spread and prevalence. So if I go back to the list now and add the quote counts, you can see that it's sort of aligned mostly until you get down to the bottom. And it's just a simple example. You can see now the quote counts don't rank like you'd expect them to. A factor with 11 quotes ranked slightly higher than a factor with 18. So this factor with 18 would have been an issue that was discussed in fewer states, fewer sectors. Maybe there wasn't triangulation between meetings and interviews. And then the weighted ranking on the right is a combination of evidence and rating to get an overall importance. Okay, so I'm going to look at two of the factors now. you can see, I'm not going to read all the quotes out, obviously, you can see people are talking about interconnectivity, having multiple systems for data collection, sharing test results, knowing where other sites have done testing and where they haven't, so trying not to double up. So just a small example there. And then as an enabler, peer workers was discussed as an essential component. And we hear this over and over, that peer workers are such an invaluable part of the testing process. So what are the critical factors for success at scale with the national program? So this is what's working. There's a strong perceived relative advantage of point of care testing. The partnerships are enabling coordination, and there's visible leadership and local champions. What's holding it back? IT and digital connectivity gaps, workforce capacity and workflow burden, persistent stigma, and financing uncertainty and competing priorities. So what's needed? Investment priorities, and obviously this is a pretty sort of simplified conclusion, but priorities in digital connectivity, specifically clear pathways and minimum standards, simplified workflows with accessible and repeatable training, and that equity-focused implementation based on peer involvement, culturally safe spaces, and discrete access. So that's the conclusion of this project for the national program, sort of simplified. But what do you do after you've got your factors? So this is where I kind of expand a little bit into implementation science a bit more widely. Can I get another show of hands who knows the ERIC? Okay, a couple people there. So the expert recommendations for implementing change are for strategies. So if you're using the CIFA for implementation determinants, for barriers and enablers, the ERIC is for strategies to overcome barriers. There are 73 strategies across 9 clusters, which you can see on the right there. And there's even a tool online to match identified barriers from the CIFA to the ERIC. So there's a wall of text coming, but you don't need to understand it all. This is just sort of the details of the framework. In each of those domains or clusters, you can see the strategies there. We actually coded at the same time as we were coding to the CIFA, the barriers and enablers, we were coding strategies as well to the ERIC, and it looked a bit like this. So larger areas were where we coded more data. So this is something that I think Will is working on at the moment on these strategies. It was sort of outside the scope of this first project that was just barriers and enablers. But you can see the sort of significant areas that we were seeing and hearing about in the data of how people were employing strategies in the national program already. You can see there's a really big focus on tailoring strategies and being adaptive. You can't read all of them, but identify and prepare champions, as well as capture and share local knowledge, use advisory boards and workflows, intervene with clients. I think this was referring to incentives again. But anyway, so that's just a little overview of the ERIC. So how implementation science supports learning at scale. Scale and adaptation are often in tension. Large programs are expensive and complex, and constant change isn't easy. Implementation science helps to resolve that tension by helping identify where change will have the greatest impact, and to do it in a structured and evidence-based way. And why I have found it a useful tool. So some of my, I guess, reflections over the past couple of years. I felt coming towards it as a qualitative researcher that it really helped me to bring discipline to complexity. So you can see the massive amount of data that we collected in this program. It just became really difficult to, for us at least, to sort of apply the usual qualitative methods to it. Implementation science helps to give your coding and your analysis structure, but without oversimplifying it and without losing nuance. So it can translate that qualitative information into signals at scale without losing detail. And I find that it balances rigor with pragmatism, theory with real world delivery. It makes improvement systematic rather than reactive. And for programs operating at scale, that is incredibly valuable. And I think I went too fast because I'm just about to finish. Thank you so much to all of the partners of the national program. Obviously, it's such a huge collaboration, as I said before. The amazing people at the Kirby here who are running it. I've kind of sat back and assessed the national program for years and looked at the pieces of it, but I don't drive it. I don't have anything to do with the day-to-day operations, and it's such a huge effort from the Kirby staff here and Flinders and all the sites involved as well. And if you want some more tools, large language models and frameworks, there's a couple more there. Theoretical domains framework, behavior change techniques. There's a list of LLMs. We used Roberta, and there's the matching tool as well. Okay, thank you, everyone.
Thank you very much, Tom. Sure. Okay, so we've got some time for some Q&A now. So if you would like to ask a question, please jump up and use one of these mics on either side of the room, and I'll double check and see if we have any questions online as well. Great. Thank you, Kathy. Over to you.
Giants in here. Great presentation, especially for someone who doesn't know anything about implementation science. It was quite interesting just to see, and you presented it very clearly, which is lovely. I have a couple of questions, just thoughts, and if you could explain a little bit more. The AI part I found really interesting. So I'm wondering if you were to use it again in the future, would you be using the same LLM, or is there others that you would consider, and how would you use it? You said there's benefit, and I don't think you drew that out that much when you were talking to it, time permitted. And just the scale, you go from -2 to -4. I was just wondering if that scale was a little bit more nuanced, if you had more levels, would that have made a difference in terms of the what's the word? How well they both did, the Kappa score and etc. Thanks.
Yes, to everything you said. Exactly right. So, so next time, this was a bit of an experiment, just to see. It just started as an idea. How would sentiment analysis work with this? So I actually just started with the lexicon, and then I was like, that's way too much work. How can we help with that? So brought in the LLM. It went through a few iterations. I used 2 others initially, and I kept sort of upgrading it, but I kept it something that could be run easily on a standard computer. Obviously, the more powerful the AI, the language model, the more power it needs, the more energy it needs. So, I think in future, you want to expand it to specialized large language models, and I don't really know. I think that's an area that I see being explored in terms of building, sort of training large language models on implementation science data, for example, or just anything that's relevant. So yeah, this used a really kind of standard understands language in general, sort of language model rather than something specific. So next time I'd go bigger and trained on the type of data that you were going to be dealing with. And then as for the scaling system, -2 to +2. So I think that works for the rating something as a barrier or an enabler. But next time I would definitely just get rid of that entirely for the sentiment analysis. I think because again, it started out with just trying to see if it would match that rating system. And so we just kept it that way to the end. But next time I would, just make something up completely, just do -10 to +10, or just find some scale that makes sense. The tricky thing about it is that the large language model doesn't just give you a score like that. You need to use different algorithms to sort of stretch and compress it into something that makes sense. And I think once you start, I'd rather let it speak for itself, sort of thing, than try and find the exact right algorithm to put it in the right place. And I think if you just give it space, then you can do that. Yeah, sure. Thanks for your question. Okay.
I have a question for you.
Okay, sure.
Hopefully the speaker will pick it up from here. So you've spoken about how you and the team discussed each of the factors and then assigning them a valence value, so that +2 to -2 and mixed or neutral.
Mm-hmm.
Are you able to give us a bit of an insight into that process? Because it sounds like it was pretty intense. How did that work?
Yeah, good question. Let me try and remember. It's very strange because it's subjective. And so there were actually probably as many discussions about that as there were about what the ratings actually were. And it is a small scale. What's the difference between a moderate factor and a strong factor? So I think the idea is to, there were 2 of us doing this. I suppose the more, maybe not 10 people doing it, but if you had 3 or 4 or something, maybe that helps. And it was just a matter of every single factor. So we did it independently, and then we met, and then basically tried to convince each other, laid out our reasoning, why I think this is a moderate enabler, why I think it's a strong barrier. And then, half the time we sort of went with my option, and half the time he went with Will's option. So I'm not sure there's much more of you just take time with it, and you base it off the data. So there was a kind of an interesting issue where we would have outside knowledge of just being familiar with a national program of a factor, and the data would be saying that it was an enabler, and we thought it was a barrier because we knew other things about it. And so we had to sort of decide early on, do we bring ourselves into this at all? And in that respect, we decided not to. We said we have to report the data as it's coming from the data sources. We're not the data sources. So we tried to keep our own perspectives of how the national program was working out of it, and just see what people were saying. And you have these clusters of quotes, and you have maybe 2, 3, 4, 5, 10, 20 quotes per factor. And you just try and decide as best you can what's really influential and what's moderate. And that's why I think that's what led to the sentiment analysis, because a lot of that is the way that people describe things, right? If somebody's describing as a factor as a huge issue, it's a catastrophe, you're more likely to read it and call it a strong barrier. But you try to, as we saw with the sentiment, it's different, and you try to find a bit of a mechanical place in there where you're reflecting on what people are telling you, but you're also trying to keep it in perspective of the wider thing. if one person is saying this is a catastrophe, but everyone else is saying, you know, it's not so bad, then you kind of sort of try and decide the ultimate picture.
Okay.
Does that make sense?
Yeah, it's really interesting. It's quite insightful. So thank you for giving us a bit more of an insight into how that process happened.
Sure.
Yeah, does anyone else have any questions for today? All right, well, it looks like we all get a little bit of an early mark today. Thank you again very much, Tom, for the presentation. And will we get to see more of this work in any other formats? Are you looking at publishing this work in the future?
Yeah.
Great. Well,
this paper's almost done. Should be coming out soon.
Oh, excellent.
Should be submitted soon.
Almost hot off the press.
Yeah.
Exactly. I will keep an eye out.
Okay.
Thank you very much
Thanks,
for your time.
Michael.